Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, and welcome to your hometown medical minute. I'm your host, Hal Brock. With me, as always, behind the cameras, our IT director, Mr. Ed Harrison.
Hey Hal, how you doing today?
We've got a great show for everybody today. Dr. Shaun Hajjari, our optometrist, is here. It's Cataracts Awareness Month. He's going to talk to us about the symptoms, the treatments, what you should be on the lookout for in regards to cataracts. It's very interesting as well. We're going to get a little preview of his new show that's going to be coming up here on SPMG TV, Beyond Vision Care. So very cool stuff. We had a great week this week. We actually went over to our Anadarko clinic right there, 1104 East Central Boulevard, right as you're pulling into Anadarko. Ed, if you're driving from Chickasha.
Yeah, Dr. Belt's office, right over by the OSU Extension Center in Anadarko.
Right there on your left, Dr. Belt Family Medical Clinic, Southern Plains Medical Center, Anadarko. Dr. Belt's been there 40 years treating and serving the Anadarko community. Jennifer Dorsey there as well, and she does BioT. We did a little mini health fair. We called it SPMC Anadarko's Health Check. Cool 105.5 FM's Lee Roberts was there playing all the top hit music, interviewing the providers. We had free vision screenings. SPMC Dermatology's Courtney Dahi was there. She did free skin cancer screening. We've had a lot of people reach out to us on Facebook telling us that they missed it. They wish we would have another one. So here it is, guys. We're going to have another one here, June 26th from 11 a.m. to 1 p.m. right here in Chickasha at our location here, SPMC Chickasha, 2222 West Iowa. All right, so I am super excited to introduce our guest, optometrist, Northern native, Dr. Shaun Hajjari. Doc, man, thanks so much for taking your time.
It's a pleasure, man.
Absolutely. Well, we've had you on before, and you're really cool. We've got nothing but incredible feedback from all of your patients. You're doing some miraculous things, man.
I
really
appreciate it, man.
Yeah.
No, it's a team effort. Starts with Frankie up, the very front to Bonnie, when they see her. So it's a team effort, but we're enjoying it and really getting busy.
You guys they have an incredible team here at Southern Plains Vision Associates. Of course, you're here in Chickasha, and you're also in Anadarko. You have offices over there,
right? Retail
in both,
yeah,
which is really cool. They actually have for Father's Day, they have half off sunglasses, but that's actually extended through the full month of June, right?
Right.
All right, cool.
Father's Day.
Yeah, absolutely. So make sure you Today, though, I wanted to bring you on. It's actually Cataract Awareness Month. And could you tell us a little bit about what cataracts is?
Yeah, so really cataracts are really just, we're all born with a natural lens.
Okay.
And as we age, it's with, we all live long enough, we'll all get cataracts, but...
Oh, really?
Yeah.
Okay.
But the lens starts to just get thickened with calcium and just build up.
Okay.
And then it basically gets cloudy.
Oh, wow.
And it happens so gradual that patients don't even know. So gradual. And so usually patients will start noticing if they close one eye at a time.
What are some of the symptoms? I mean, when we cover eye, I'm guessing kind of like blurry vision?
Yeah, so some patients a lot of times glare. When the glare is really bad, a lot of times cataracts can cause glare problems.
Really?
Glare issues, yeah. Okay. So yes, and there's several different types of cataracts. So we call one, it's like spoking, like bicycle spokes.
Huh.
But you only really see it when the patient's dilated. Their pupil is,
Got you.
And so most of the time they don't walk around dilated, so you really don't see it unless we dilate you, and then we can maybe see it.
Okay. So how do you dilate somebody's eye?
Yeah, so there's several drops. We'll put one numbing.
Okay.
Because the dilating drops have a bite to it.
Okay. Oh.
And for comfort purposes, put some hair on your chest.
Yeah, right.
We just use some drops, 2 drops, and it can dilate up to 3 to 4 hours.
Oh wow. Okay.
But depending, patients with darker eyes, it'll last longer.
Really?
Patients with lighter eyes will last less, or not as 4 hours. You're talking 3 or so.
Okay, nice.
So.
Is there any age specific? You said it kind of happens when you get older.
Yeah, for the most part. Now
Okay.
there are kids can develop they can have congenital cataracts when they're first born.
Okay.
And a lot of times, and like even patients taking steroids, whether topical eye drops or orally.
Really?
If it's a lot of steroids can actually
Ramp it up a little bit?
Yeah.
Huh.
And same with that nasal spray.
Flonase?
Yeah.
Yeah.
It has like a little steroid in there.
Whatever's
So,
in it.
yeah.
Like a histamine, like an actual steroid, right?
Right.
Like you just said. Okay.
And so some patients, they don't, we don't really realize it, or, and it happens gradual. So.
Huh. Is it treatable? Is it curable? Or is it treatable?
Yeah, it's treatable.
Okay.
And once you have cataract surgery, they don't come back.
Oh, okay.
So, now, the only thing I tell patients is after cataract surgery, they remove your lens.
Okay.
Because it's already in a capsule. So they remove what was in that capsule and they put your artificial one back
Just
in that
back
same
where it
bag.
was.
Yeah.
Okay.
Now, the only thing I tell patients, the only thing that could happen is they could develop scar tissue after cataract surgery.
Okay.
And not everyone develops it. Yeah, and so patients come and they say, doc, I don't see as well as I did after cataract surgery. And so my first instinct is to maybe that scar tissue to check that. So I usually after cataract surgery will always have a patient back 6 months after.
Okay.
To monitor for that scar tissue, but some can have it 10 years later, some a month after. I mean, everyone's different.
Yeah, right. So now, can you go back in and get the scar tissue out without replacing the lens, or do you go and do the procedure again?
No, yeah. So that's a good question. So we have a YAG.
Okay.
It's a laser.
Okay.
And I'll dilate a patient, which is the drops.
With the drops.
And then once it opens up, I use that same laser, just like when people come in for an eye exam.
Right.
Except this has a laser. You don't feel pain. We numb the eye with the drop. And it takes less than 5 minutes. And
no kidding.
Yeah, and then they go about their day.
And you just do it right here so they can come in. That's really convenient.
That's right.
Surgical procedures, what's your kind of process?
Step is to really present it to the patient and really tell them, here's your options. I recommend cataract surgery just because glasses, they won't fix it unless you clear off the dirty lens.
Okay, got you.
And and I try to just let the patients decide. Obviously we try not to wait till the cataract's too dense, just because that's more energy the cataract surgeon will have to put in the eye.
Okay, that makes sense.
So I usually have a grading scale, and if they start, where I usually grade them at, and if they qualify, with the glare test and so forth, then I just, we'll get them back for cataract evaluation.
Okay.
They'll make some measurements, and then that following week they'll go see Dr. Bellardo in Anadarko, and he'll fix them up, and then I'll see him back usually the next day.
Man, that's so cool. And so the follow-up's the next day, and so you get to... Now, is it that quick? I mean, you go in there and he cleans it up, and they're going to be seeing better the next day?
For the most part.
Wow,
so
okay.
They usually will see a difference. Things will at least be brighter.
Wow,
now,
cool.
Depending if they're diabetic, patients that tend to heal a little slower.
Okay.
So everyone heals differently, every eye heals differently, but for the most part, they will see pretty well. And I always tell them every day will get better.
Right.
We shouldn't be going back in the opposite direction.
The opposite direction.
Right.
And then that way.
Yeah.
Yeah.
And I think too, and then once they start taking their drops, and especially when I see them back a week later, they really notice the difference, or they're like driving themselves, I mean, it's pretty instantaneous.
That's really cool. Now, it hasn't always been this easy to clear up, right? I mean, this is newer kind of technology and we're fortunate to have you, first off, on the front lines, and then Dr. Bellardo, who you mentioned, world renowned. This guy's done like 70,000 vision correction procedures. So as a team, you guys are pretty legit. That's pretty cool.
It is. We have a good team, but yeah, right off the bat, like you said, Dr. Bellardo will go in and do his thing, and then we work pretty close together, and then of course I follow the patient usually a day after, and then a week after, and then a month.
And then a month after. And then at that month, should you see enough, at that point, a little bit better?
For the most part, yes.
Okay.
Because we always say, we'll get you a glasses prescription if you need it.
Okay.
And we always say a month from the second eye that's done.
A month from the second eye that's done.
So they'll usually do one eye at a time.
Okay.
And then once I go to look for a 1 week checkup, at that visit, they'll get the paperwork ready for the other eye.
Oh, okay. All right.
And then that following week, Dr. Bellardo will do their other eye.
That's probably safe, right? You don't want to do both at the same
Right.
time. Be walking into walls and everything.
That's true.
So now, do you get it in both eyes always, or can somebody have it in one eye, or how does that work?
Yeah, no, that's a good question.
Okay.
It's really, some can have it in just one eye.
Okay.
Typically both, and one maybe be worse than the other.
Right.
Congenital, but yeah, I mean, it's really, everyone's a little different.
Okay.
But usually, for the most part, especially the elderly, I'll see both eyes, but usually those be one that's a little bit worse than the other, or
Okay.
about the same.
Besides doing a regular vision screening, is there anything preventively or anything they can come and see you in regards to cataracts to check to see if they're a candidate for it?
If patients have noticed, especially the patients that don't have correction or
Okay.
need correction,
Yeah.
but they're noticing it's almost like looking through a fog or a haze, or it's almost like cloudy vision or like smoke, they always say. And they
Okay.
rub their eyes and it doesn't clear. Could be cataract, could be dryness too, but yeah, they can just come in and for a regular exam, and then we go from there, and then I usually do the whole exam and then present them what I'm finding, and then let them choose really,
Kind of their path, which way.
right. Unless it's really bad, then obviously I'll recommend
Kind
it.
of step in and say, hey, look,
Right.
this is needed. So,
Right.
because I'm amazed at some of the things you do, and some of the treatments, and you were going through and you were kind of showing me some of the pictures of some of your patients and some of the things that you've done for them. And we actually have one of your clips. We're going to start doing periodically a new show here on SPMG TV, Beyond Vision Care,
right.
with Dr. Shaun Hajjari. I'm super excited about this show. You guys, we're going to learn a ton. It's going to be a lot of fun. We have a little clip here. Let's take a look at it. I'm super excited about this.
Yeah, let's do.
I came to see Doc here, and I've been blind in my right eye since 1984, without the possibility of getting it back. And people said they could do everything on the side. I came to see him. He looked in my eyes and said, "I think I can fix you right up." And within 30 minutes, I had my eyesight back. I went from 20/80 in my right eye to 20/25 in my right eye. I can see now. I can read again. I just can't say enough about how good he is and how well he treated me. This man, I'm not saying he's a miracle worker, but after being blind for 35 years and being able to see again, possibilities are he can probably help you out with whatever problem you have. And I would suggest.
That video
Yeah.
is actually from after a YAG procedure.
Oh, really? No kidding.
So
okay.
So we
cool.
Yeah. So that scar tissue, the medical term is PCO. Stands
Okay.
for posterior, so the back.
Okay.
The C is the capsule.
Right.
And the O is opacification.
Opacification.
Fancy word, but I like scar tissue.
Okay, yeah.
But yeah.
Scar tissue. Okay, thank you.
Yeah. So he had that. We did the YAG procedure. That's
Oh,
what it's
wow,
called.
okay.
YAG capsulotomy.
Wow.
And it cleared up his vision, and like you heard from him, and then you went 20/80 to 20/25.
Yeah. And that's really cool, man. I mean, you've changed this guy's life.
Yeah.
And
Well,
you can see.
I'm glad that we can, and that's what we try to do. We try to let patients, I take care of them as if they're my family member.
For sure.
And that's what we do. At Southern Plains Vision Associates.
I'm humbled by what you do, man.
Well,
Thank
I
you.
appreciate it.
Yeah.
Thank you.
You really need to come and see Dr. Hajjari. Like I said, you need to have an eye exam every year or every other year. It's very important. To do that, just give us a call, 405-592-EYES, or you can go to our website, www.spmcmed.com, and you can actually schedule your own appointment. Thanks so much for watching. We'll talk to you guys later. Cool. Thanks, bro.
Yeah, man.